Hello, today I'm going to teach you the self-treatment technique tongue pull. This one looks funny, but it is amazingly helpful. I noticed changes in my posture almost immediately, and just it helped me with a lot of neck and even like upper back tension. So I first just it's fairly straightforward. The name is tongue pull, and you pull your tongue. I grab my tongue with two hands, thumb and forefinger, and I pull. Now I'm not yanking my tongue out. At some points it does get rather intense. You can see I like make faces and grimaces, but not because I'm pulling very hard. With MFR, we say we find the barrier and we wait. So what that means is after grabbing my tongue and making sure I have a good grip, I pull until the first feeling of tightness, tension, resistance, and just wait for the tissue to soften. I felt it a lot underneath my tongue, and you can see I'm getting into it there. It feels really good letting that tension out. And then I just pull, and you want to maintain steady, constant pressure, but not a ton of pressure. You don't want to be yanking. Like I said, MFR doesn't force. We wait and we soften. With this in any treatment, you want to hold it for at least 5 minutes. There it is. There it is, getting intense for me. You want to hold it for at least 5 minutes, and that gives the fascia time to respond, time to change, time to let go of the restrictions that is keeping it stuck and that it's been holding on to for so long. And it feels like it takes forever, but the results are amazing. This work is life-changing. I am so thankful to the Lord that I found this work when I did, that I've been able to receive so much benefit from it for myself, and that I've been able to help my clients get a lot of pain relief. All right, so some benefits of the tongue pull. You can see I'm showing you what I'm doing. And I am holding on with two hands, so that if one starts to slip, I can reposition the other and not lose the length of the hold, the length of time there. So yes, it reduces neck and upper cervical pain. It improves the way the jaw functions. It reduces TMJ, tension, dysfunction. It can help with headaches and migraines, especially caused by pressure, tension, occipital headaches, headaches that start in the neck. Can relieve throat tightness and swallowing dysfunction, like when you have that feeling of a lump in your throat sensation, or it's chronic throat clearing. Even if you have difficulty swallowing pills, I don't usually have difficulty swallowing pills, and I don't know if I've noticed any change in that, but that can be helpful. It can help with improving breathing patterns and airway mechanics. It reduces accessory neck breathing. I know when I was really running a lot, I noticed that my neck was tight and that I was using my accessory muscles to breathe. It's good. It's supportive for mouth breathers and people who snore and have shallow or anxious breathing patterns. It enhances your vagus nerve regulation and your parasympathetic tone. That's all fancy ways of saying it helps you relax and let go of just a lot of your emotional fight or flight responses. It can even improve voice quality and reduce vocal fatigue. It's funny, sometimes when I'm working on people, I can, like, sometimes we chat and I can hear their voice change as I'm working, and it's just fascinating. We both notice it. And but yeah, if you are someone who uses your voice a lot, a singer, teacher, anyone who's just talking a lot, or maybe you just like to talk a lot, that's fun too. This can help reduce your vocal fatigue. It can improve, it can balance facial symmetry. So if you want your face to be symmetrical, It can help digestive and reflux related symptoms more indirectly. It can also help with any emotional trauma related to your face, throat, mouth. A lot of people have dental trauma. Um, yep, kind of gross. Started to drool there. Anyway, thank you for watching. I hope that you will try it out and drop in the comments how you feel after trying it, and maybe try it for a couple days and see how you feel. There I am. I'm showing you what I used to look like, and now it's easier for me to stand up straight and have my head back, and it's easy to do that, but it still feels weird. So it's also going to be a habit thing I'm going to have to work on. Alrighty, well, thank you for joining me. And again, let me know how it helps you.